world where human life has totally been destroyed. Humanity has abandoned the planet and left in large Starliner spaceships while they wait for humanity to be able to live on Earth once again. It's not until an AI robot named Eve comes to the planet searching for life that do humans learn between the power of determination, goodwill, and love how to save their world. Well, this hasn't happened because it's the plot of the WALL-E movie, but what has happened is that AI technology like WALL-E and Eve are here today and ready to change our world. Hi, I'm Juliana, and I'm here today with my colleague Sophie, and we're Virtue Vision Consulting, here to see you succeed.
So we're here today to evaluate and identify the potentials of applications of AI in the healthcare sector for the purpose of value creation. And when we're doing this, we're going to look at your key stakeholders, the potential gains of investing in AI in healthcare, the legal implications of AI and integration in healthcare, and we have to keep in mind throughout this presentation, what are the ethical implications of this investment? And so before we start, we need to look at our ethical dilemma.
Now, there's an ethical dilemma when it comes to AI. Yes, AI can present itself as friendly robots like WALL-E, but it can also be inaccessible, hard to understand, and borderline scary. Yes, AI can improve efficiencies and outcomes within the healthcare sector, but the implications of data bias, transparency, and privacy make it so that there is hesitancy in its use.
So first, we're going to look at your stakeholders. And when we think about our stakeholders, we have to think about two kinds of stakeholders. Your internal stakeholders that are directly impacted by the decisions you make, and your external stakeholders that have kind of a waterfall effect from the decisions you make and how you decide to apply them. And so when we look at your key stakeholders, we have you, the private equity firm, and your investors, followed by patients, medical practitioners, and regulatory bodies. And so now that we've looked at your stakeholders, before we go into a legal and ethical analysis, we really need to make sure that this is a sound investment to make.
Now, we're going to start by addressing the market potential for AI in healthcare, where the United States is expected to see the highest growth. The key considerations we need to keep in mind here are that there's a positive relationship between healthcare expenditure and economic performance, as well as the fact that the majority of AI-driven innovation occurs within the United States. Therefore, this needs to be the scope of your investment. Now, when we talk about AI applications in healthcare, what do we mean? Well, there are three that are the most permanent, and that's health tech. So this is your services, your management software, could even be ChatGPT. We also have biotech. So this is pharmaceuticals, clinical testing, trials, and such. And lastly, medtech, more so therapeutic devices and medical technology. And your investment possibilities need to fall within these applications. Let's look at the state of the U.S. healthcare industry. Let's say WALL-E needs a tire change and wants to make an appointment with his primary care provider. Well, let's start with the scheduling. This can take a long time, weeks or even months, due to the fact that 50% of U.S. physicians believe they are at capacity. Next, you have the appointment, but your face-to-face time with the physician is cut short due to the fact that 56 million people are not seen a year by doctors due to administrative tasks. Next, you have to go for additional testing, further delaying the time it takes to get answers to your concerns. And maybe after that, you have to go to the pharmacy or you need treatment that may or may not even exist. Lastly, the follow-ups. Specialists, appointments, prescriptions. This can be confusing and time-consuming. Therefore, as a firm, you really need to focus on solving these healthcare pain points through AI investments. Now, what's really important to keep in mind when we look at the financial perspective is the fact that both the technology and healthcare sectors present opportunities. When we combine the high-growth nature of the technology sector with the defensive and permanent demand that exists within the U.S. healthcare system, what we see is an unparalleled opportunity for portfolio diversification across all three applications. Therefore, it's an investment opportunity you cannot pass up.
And so now that we know that we should be investing in AI in healthcare, how do we do this and what regulatory considerations do we need to make? And so the first thing that we need to know is that within your investment scope in the United States, there's no real regulation around AI, but there is regulation around healthcare. So for example, you have regulation between the patient and provider communication, you have regulation for your drugs and your medical equipment, and you have regulation around the quality that patients should be receiving. And so when we think about the lack of regulation around AI, you need to develop an internal regulatory framework for your investments. And following this, when we look at what regulation has passed, in the EU, you have the first regulation on artificial intelligence that categorizes risk into three different categories. Unacceptable, which is a threat to persons. High risk, which is your current product safety laws kept in place with disclosure on AI. And limited risk, which is complying with transparency, making sure the consumer knows that AI is being used. And so when you think about these categories, you should be prioritizing your high to limited risk investments. And so now that we know the legal implications that the regulatory isn't really there for AI, we need to look at ethics to make sure that we're properly protecting your stakeholders.
Now, we talked about the ethical dilemma that exists around AI, and this is no different when we talk about healthcare. Sensitive information, and honestly, matters of life or death. So again, the main considerations we need to know are the implications of data and the implications of the model. This is where the fundamental concerns about AI use stem from. Therefore, in your investment framework, you need to consider this and put in protections when it comes to this regard. However, these implications can change, but what doesn't is ethical theories. Let's look at some. First, utilitarianism, acting in a way that produces the greatest amount of good for the greatest amount of people. Now, when it comes to health tech, it's really a wide variety of healthcare applications versus biotech being a bit more niche and medtech being more technical. Therefore, we would recommend health tech. Next, Rawls' theory of justice, acting in a way that produces the greatest amount of good for the least advantage. Now, health tech doesn't directly address equity or accessibility, whereas biotech and medtech do. But when we apply that veil of ignorance under Rawls' theory and say, who is the true least advantage? We would say it is those with untreatable or rare diseases, therefore investing in biotech. Lastly, Kantian ethics, acting in a way that should be replicated as universal law, bringing back those data and model implications and concerns. When it comes to biotech, there are large concerns around biometric data, medtech, large concerns around culpability and fault analysis, and when it comes to health tech, it is easier to abide by data privacy and maintenance standards. Therefore, we would recommend a health tech investment.
And so when we think about your investment, how do you make sure your investment remains ethical throughout its life? And so with this, you should be looking at the impact multiple of money that considers the scale of the social good that you've resulted from each dollar invested. Where you look at the scale of people with facing a problem, your solution, and the economic value of solving this problem, and the adjustments that have to be made accordingly. And so when you calculate the impact of your investments, you're able to look financially at the social good you created. And so when we look at your options, when you consider ethicality, your timing of entry, your regulatory risk, and your impact potential, we can see that you should be moving forward with health tech as your primary investment.
Now, let's reflect back on the WALL-E movie, where when humans and robots finally worked together, they were able to turn a ravaged planet into a paradise. So our strategy for you is going to have you working together with AI in order to set the tone for innovation, not only at your firm, but within the healthcare industry.
And so we're proud to present to you Generating a Healthier Tomorrow, a 4-year strategy to invest in AI health tech companies to create value financially and socially. Throughout this strategy, we're going to walk you through your new investment process where you've integrated ethicality and social impact into your investment process. So first, let's prepare to invest. And so when we prepare to invest, first thing we have to be doing is preparing an ethical investment framework with 3 pillars: security, patient first, and impact. Security is all about your data protection. How are you staying HIPAA aligned? How are you maintaining your data? What are you doing to protect your data? When we think about patient first, does your patient know that they're using AI within their treatment? Do they have the ability to opt in instead of opt out? And how are we creating a positive impact?
Now, when we look at the impact potential, we have to ask ourselves key questions under health tech. Is this technology going to improve health, improve care, improve access, and improve data best practices?
Next, we're looking at investing in health tech.
So we've addressed 3 different companies that fall under 3 different themes. When we look at these companies, we have to look at the one that has the best round, the highest impact potential, the best data considerations, as well as the fact that it's patient first, which would give you Strive Health, kidney care systems that can help with diagnosis and treatment plans.
Next, we have to integrate due diligence. So with this, you'd be looking at the current legal atmosphere, what the governance framework for the investment company looks like, and also the ethical frameworks that they have in place. And so when we look at an impact analysis for Strive Health, we'd be looking at metrics such as reducing dialysis crashes and hospital readmissions.
Now we're going to optimize. So let's start by looking at value creation. So here we know that there are many different kinds of value creation strategies that you can do as a PE firm. For Strive Health, we would look at scaling, and we would look at strategic partnerships. We recommend you hold your portfolio company for 4 to 7 years, aim for a 3x return on your capital, a 20% baseline IRR, as well as establishing recurring revenue.
And so lastly, we're going to calculate the impact of your investment. So when we look at 37 million US adults who are estimated to have kidney disease and reducing those hospital readmissions that are coming in at $13,000 per hospital admission, and we adjust for the population within access to Strive Health, we'd be creating the social good of saving $1,300 per kidney patient in the US. And so by integrating ethics into your investment, just like WALL-E, with the power of determination and goodwill, you have created financial and social value in the US and globally. We thank you, and we open the floor.